are you tired of the current COVID-19 regulations? Do you want government to scrap them? The regulations have been in place for 2 years now, and many people want them to be lifted and for life to return to normal, whatever that means. Government has extended the national state of disaster despite promising to do away with it. In order to bring this situation to an end, the Health Department has now published its proposed health regulations for public comment. They'll deal with COVID-19 and other notifiable medical conditions outside of a national state of disaster. Is this the way towards a long-lasting solution despite the COVID-19 virus still in our midst? Well, my colleague, the eNCA reporter Heidi Giokos, covering this for us and joining us now live in the studio. And we are also going to be talking to Professor Mosa Moshabela, medical specialist and UKZN Research and Innovation Deputy Vice-Chancellor. Heidi, good afternoon. Before we bring on the Prof, let me start with you. I mean, it's very interesting that just the other day, the President was in Parliament last week answering questions, this question of the national state of disaster coming up. And he says, yeah, we want to lift it. We want to get back to normal. But the current state of disaster has been extended by another month. And there are now these regulations that the President mentioned, and they've now been gazetted. It's a long document, but you've had an opportunity just to get a sense of what is it about.
Yes, certainly. I think what's also important to highlight from what the President said in Parliament last week is that he also wants to do away with the national state of disaster, but he does not want to be reckless. And I think this points exactly to how the Department of Health has gazetted this over 150-page document that provides recommendations of how the new way of life will be still considering COVID-19 regulations. So those who want to enter or exit South Africa don't need to provide a negative COVID PCR test 72 hours old if they are fully vaccinated and can provide a vaccination certificate. Also, mask wearing still being considered. However, if it is outdoors, perhaps that could be done away with. Government also recommending that we focus on ensuring that there's still that 1 meter social distancing rule, sanitizing as well. So these are some of the things that the Department of Health has gazetted to say perhaps we should remember to be careful, but try and ease some of the restrictions because this has been going on for 2 years.
What stood out for me was also it covers the issue around refusal of medical examination and testing and treatment and things like that. By the way, just for your information, in case you want to get hold of this, it's a government gazette and it's entitled Regulations Relating to the Surveillance and the Control of Notifiable Medical Conditions Amendment. But you've been chatting to some people just to gauge their sense about what is happening and what is likely to go on forward.
Yes, and I think South Africans are very tired, Brother, and one can imagine. We've had the national state of disaster in place since for 2 years now, and I think many are very tired of mask wearing. Many are very worried about what this is going to mean. Are vaccines going to become mandatory? Are you going to have to provide a vaccination certificate should you want to enter entertainment spaces? But South Africans, I think the clear message that came from every single South African was that they are tired of wearing masks and they feel it's not working. We got a chance to speak to some of them today in Johannesburg. Let's listen to what they had to say.
I think we should wear masks anymore because I think that everyone ignores the regulations anyway. I think we're just wearing it just to look pretty or like just because the government says we should. But other than that, I think no.
If everybody vaccinates, then you can do away with it. So I think it's a good thing.
And do you think it's a good thing that government is asking the public to comment on regulations?
It doesn't matter what the public thinks. So I don't know. They follow their own head. So I hope they can do away with it.
I think it's a good idea to keep them because we're actually a very long way from getting over this whole COVID thing. And the only way we're going to get there is if everyone gets vaccinated, you know, all of us follow the protocols and everything that needs to be done. Because if we don't, we're going to be in this situation for a very long time.
We should keep sanitizing. And then we should keep wearing masks if that's what they want. But I don't see any use of a mask.
I don't see any use of the mask. Professor Mosa Moshabela, let's bring you in now. Hopefully you've heard some of those comments. We're just setting the scene here with Heidi, and she's been covering the story for us. That's what she's focusing on today. The regulations might change. Just generally, what's your saying? The President telling us last week in Parliament, yes, the national state of disaster will end, but the government does not want to be reckless in how it approaches and deals with the transition to the next phase.
Yeah, greetings, Pradan and Heidi and the viewers. No, thank you for the invitation and these comments. It's actually quite refreshing to hear what the public thinks, and I want to agree that I think people are fatigued in terms of wearing masks, and I think if we can, for example, follow the regulations, but make sure that they are being kept at the most minimum. Follow the kind of guidelines that are absolutely necessary to control the spread of infections or the diseases that the government is identifying, especially the respiratory ones, specifically COVID in this case, then I think that will be really helpful. And some relief, like saying that people are not going to have to wear masks outside, might actually be helpful. Then people can say, well, I'll use a mask only when I have to, and I don't have to wear it all the time. But all in all, I think that, part of the problem is that we didn't know all of this. We've been learning about all this evidence as we were going along, as the evidence emerges, as the science kind of evolves, and government didn't have the information on what to do. Part of the delays in them making the decision had to do with the fact that they didn't really have the reliable evidence. The evidence, we have progressed from where we were in 2020 to where we are today, and government needs to make those difficult decisions to help people cope, even though we are not out of the pandemic yet, to then say, how do we make sure that people can cope with the current challenges, as people call it, new normal or whatever the case might be, but make sure that the burden on the population is reduced, but at the same time, not relax the regulations to an extent that we are reckless in terms of disease spreading without any monitoring or control measures.
With that cautious approach, in your view, also be addressed according to this, because it touches on issues of isolation if you're feeling you're sick, and issues of testing and making it a little bit still mandatory that if you're not sure, if you've got symptoms, you need to go and test to make sure. Will that support your view of that caution?
So on the one part, there is something that is really important that government has to resolve. And I hope that you and your team and Heidi can really look closely into this. The one challenge that we have here is that there is no clarity as to whether government wants to prevent the spread of infections or not from a policy perspective. So far, you listen to a lot of the scientists, you look at the evidence. There's almost like there's a sense that, there's no need to control infections. But if you don't control infections, we've seen cases whereby even when people had mild infection, they can still suffer consequences of long COVID. So I really think that regulations are not clear as to what their policy objective is. On the other hand, we've been talking about protecting people from severe disease, hospitalization, and death. And I think there, almost all of us agree. And if that is the agreement, I absolutely agree that we need to have a plan on how we deal with those cases that are diagnosed. But if you now look at the regulations at the moment, the inconsistency that we are feeling in the regulations is that it's not clear whether government is still set on preventing spread of infection or just focusing on controlling severe disease and hospitalization, or preventing severe disease and hospitalization. And I think, Brendan, that's where I think we need clarity from a policy perspective. If you can clarify that, then it will be easy to make sense of the regulations as they are presented at the moment. Right now, it just feels like they are hovering on things that we don't really need to focus on. These are things that we were concerned about in 2020, and they don't necessarily kind of incorporate the ideas that we have learned over the past 2 years.
Prof, I'm just going to come in here and ask you a question about this uncertainty, because it's something that I also asked you on Saturday with regards to this vaccine mandatory committee that the President spoke about on last year, actually, in his last address when Omicron decided to visit us. And that is also something that government has not been clear on. They say that there's going to be mandatory vaccines for certain events, certain settings, but now it's almost as though they want to hear where the public stands with regards to that. Do you think it's vital for government to try and consider mandatory vaccines, especially for certain settings, or do you think that's just going to cause more havoc, as we're already seeing hesitancy when it comes to the vaccine rollouts?
So my position is that government should actually certainly adopt a mandatory vaccination approach for workplaces, certainly. And it can then be considered for other gatherings that are essential. So, for example, large religious gatherings and so forth, it can be considered for those areas. And of course, here, I think that there can always be an opt-out of the vaccine if people are willing to submit a negative COVID-19 test, just to ensure that risk is reduced. It will not stop the spread of infections per se, but it can reduce risk. And again, I do think that the vaccination is really designed largely to protect people from severe disease and hospitalization. But of course, there will be a minimal benefit of protection from some infection. So, Heidi, I think that government needs to make that statement very clear so that the population can comment on it. Right now, if you look at the Gazette, that statement is there, but it's hidden. It's not very explicit. Government says that they want to be able to mandate vaccines, to provide mandates for prophylaxis, for treatment, for quarantine, for isolation. Yes, it's included in the document, but you have to read between the lines that government is probably hoping to make this mandatory down the line. I think that this is an opportunity for government to say that we want to put forward mandatory vaccination, and let's get your inputs on how to do it in a way that is the majority of South Africans.
Professor Moshabela, thank you very much. That's all we have time for, I'm afraid, and thank you for giving us this time. And there is more to unpack, Heidi. Thank you as well for your time. I'm sure you've got more work to do. It's an ongoing thing. I mean, it's a long document, but do yourself a favor, go through it and contribute so that when there are changes that's going to affect your daily lives in terms of how this country is going to manage those notifiable diseases and others like COVID-19, you don't complain and say, but what are they doing? How do they do this? You need to be part of that process. That's Heidi Giokos, my colleague here with me, and that was Professor Moshabela there from UKZN Research and Innovation, and he's a Deputy Vice-Chancellor there.